I think for management of arthritis, knowing it is one of the important pillars to manage it. So if you educate the patient about his arthritis, I think he will become better at managing it. The task for the doctor becomes easier, that overall disease control becomes better. So I think I will cover this topic of knowing and managing arthritis in 9 subheadings. I will first try to talk about what is arthritis. Then I'll talk about what are different types of arthritis. Then I'll also give you idea about what is not arthritis. Then I go through the norm of diagnosing arthritis and also educate you about whether who treats arthritis. Patient sometimes doesn't know whom to go. We go to orthopedist, go to rheumatologist, go to physician, and I will try to then burst the myth around medication used for arthritis, that give some tips about exercise and diet and some tips for management of arthritis. So the important thing is, I think the management of arthritis uh, in Indian society have four important aspects that needs to be addressed. I think arthritis in Indian society is need by multiple names that creates a lot of confusion. Vata hai, Sandhivata hai, Aam Vata hai, what it is. We any type of joint pain, we have multiple names and we don't know what to do. Unless we recognize a particular disease by a particular name, we are not able to correctly treat it. Okay. The first thing, the Indian patient of arthritis give their arthritis multiple names, and that's not true. Okay. The second is lot of myths and beliefs about arthritis in the Indian society. So don't eat that, don't do that, don't do this, don't do that. So what is truth? We really don't know. The third thing is we don't know which doctor to approach when you have joint pain, swelling, or arthritis, something like that. So really, I want to educate you about which doctors and which rheumatologist, which doctor actually to approach for arthritis. And the biggest myth, the biggest false belief, what you call in the present, the modern society of the Indian people is they fear modern medicine much more than benefit when it comes to arthritis. So, what actually the arthritis is? So, for that, I think I want to put this slide in front of you where I think arthritis, when we come to Ayurveda, that is known by multiple names. Sometimes it's called Amvat, Sandipat, Vata Rakta, Pitta Rakta. When it's Gujarati, the people come, Sir, Va ho gaya. Something called as Va. In Hindi, we call it Gatiya Rog. So there is a lot of clouding of the thought process when we look into arthritis. So until unless we recognize what is the right name, we cannot treat it rightly. So recognizing the right name and right type of arthritis is important. When we look into modern medicine, what are the evidence say? What are the research say? What the evidence in the research say? There are more than 100 and different types of arthritis. So what does actually arthritis mean? What does the literal meaning of arthritis? When you break down the word arthritis, the one thing is called arthros, which means joints. Itis means inflammation. So when you join the two words, it gives arthritis, that is joint inflammation. And when I call joint inflammation, I tell my patient I use that word inflammation, whatever word they use for arthritis. That is va, gatia. And this word va, gatia, va, what I call, I recognize this thing as inflammation as the patient says it. And I say that inflammation should have all the three components. Isolated pain doesn't count to inflammation. There should be pain, there should be swelling, and there should be stiffness. Until and unless all these things are present, we cannot recognize a particular thing as arthritis or joint inflammation. Just for example, if you take the symptom of rheumatoid arthritis, it's one of the 150 type of arthritis we see in day-to-day clinic. So when do we recognize? Because every joint pain is not arthritis. The joint pain which you have should have inflammation. It should have pain, swelling, and stiffness. And the stiffness and pain which you have, it has maximum intensity when you wake up in the morning. Suppose if it is rheumatoid arthritis, the pain and swelling is maximum in the morning. It's 100 in the morning, and by the time it is evening, it's 20. So intensity is maximum in the morning. It improves with day-to-day activity, and the stiffness lasts more for 30 minutes. And it has wide distribution. It can affect each and all of your joints. So it can affect each and all of your joints, and shoulder joint, knee joint, elbow joint. So now you know what is arthritis is. Arthritis is a varied term. It has 150 types. We should know what arthritis is, what name we should give arthritis. So I want to introduce you what are the different type of arthritis which we should not confuse with. Because until and unless we know what are the different type of arthritis, we are not able to treat it. So the few type of arthritis I show in front of you, the osteoarthritis, which is very common in the society. It affects 1 in 10 people. So it mainly affects the knee joint. The main complaint is basically getting from sitting position, going upstairs. So it has Minimal inflammation and treatment of this arthritis is different from the other kind of arthritis. The other kind of arthritis are rheumatoid arthritis, when where we got deforming arthritis of finger joints, ankles. Then other type of arthritis may affect the lower back. There may be early stiffness, early morning stiffness of lower back. We normally call it ankylosing spondylitis. Then certain type of arthritis may come with with psoriasis, with the skin lesions may present with low back pain, joint pain, and swelling. These are the common type of arthritis. Apart from the gout, which is shown to the right corner here, gout is also very common in society. Not so very common the osteoarthritis, but yes. But we should realize that hyperuricemia is different than gout than other rare kind of arthritis. See, the arthritis which we see is beyond joints. It comes in skin, where the skin tightening, it may come in skin rash, fever, it may affect your vessels. So there are so many different type of arthritis, and one of the example of different type of arthritis are shown you here is rheumatoid arthritis and osteoarthritis. So there are these are the two most common type of arthritis. I want at least general public should be aware that these different two types of arthritis are differentiated. So when I see here osteoarthritis is normally called as Sandhi Vat, while inflammatory arthritis is called as Am Vat. Osteoarthritis is more common in the society, but rheumatoid arthritis is less common in the society. If you see here, this is more wear and tear process. If you see when you age out, that is normally the body is just like a machine. The cartilage go wear and tear over the period of time. You don't take care well of your joints; they become more damaged or more wear and tear down the line. So there is minimum inflammation, but rheumatoid arthritis is a type of arthritis in which there is inflammation even at rest. So if you don't read, they lead to damage and this leads to deformity. So management for this two type of arthritis is very different. In osteoarthritis, there is weight loss, there is exercise, there is pain management. When I talk about rheumatoid arthritis, it is more about immunosuppression and the pain management. Osteoarthritis basically affect your knee joints, where rheumatoid arthritis is a damaging type of arthritis that affect your hand joints, finger joints, and wrist joints. So after covering this topic, I want to tell you what is not arthritis. So because we have a tendency of calling every joint pain as arthritis, we should also know what is not arthritis. So I'll directly jump to slide number 2. So basically, a patient comes to me with OPDs. He says that he has joint pain, swelling, and everything, and he has raised uric acid level. So I want to first clear the cloud here. Ki raised uric acid level is not equal to gout. When you have raised uric acid level and you have joint pain and swelling basically affecting one of your joints, which comes intermittently. There is one joint at a time, there is swelling and superficial redness. There are multiple episodes. It doesn't last continuously and is precipitated by lead, alcohol, and meat. So this is the kind of arthritis associated with joint, not the other kind of arthritis. So these are not actually rheumatoid arthritis. This is actually gout. And other thing, I want to come to the patient comes to the OPD and says, sir, there are multiple joint pain, there are whole body pain, there is a lot of pain, there's a lot of fatigue, exertion, and all these things improve with rest. So, but there is no any early morning swelling or stiffness. I don't see any signs of inflammation in this kind of patient. So basically, these are not rheumatoid arthritis or these are not inflammatory arthritis. So these are basically multiple other causes for this kind of arthritis, which includes vitamin D deficiency, vitamin B12 deficiencies, hypothyroidism, sleep, and exercise deficiencies. So I talked about what is arthritis, what is not arthritis, what are the different type of arthritis, because knowing different type of arthritis will help us delineate which kind of arthritis is which treatment. And the most important thing I want to convey is how do we diagnose arthritis. So diagnosis of arthritis, see that arthritis is a very specific diagnosis. There are different type of arthritis. So basically not everybody is expert in diagnosing arthritis. So there are specific steps when we want to diagnose arthritis, whether the particular arthritis is inflammatory arthritis or the non-inflammatory arthritis. For this, I think choosing the right doctor for your diagnosis of arthritis is the most important aspect. So for because if you go to a wrong doctor, if you go through all the long procedure, you may end up landing with the wrong diagnosis with a lot of immunosuppression, a lot of other treatment, which may be more harmful than it helps you. So I think there are three most important steps for diagnosis. Before that, choosing the right doctor is important. And when you come to the OPD, we see whether it is inflammatory or non-inflammatory. If you think it is inflammatory arthritis, basically step one is based on the history. Then we go to step two. When we go to step two, we confirm whether you have your arthritis or not by the help of various blood reports which you have, serological factors, RF factor, TCC factor, ANA reports, And finally, we have step 3 where we try to diagnose you and confirm everything with the X-ray, which shows whether which stage of arthritis you are, whether you are in the early stage, whether you are in a late stage, whether there has been already underlying damage. So I think this is how we diagnose arthritis. This is how we see. This is how much we should understand about arthritis. And I will try to answer this one most important question in front of us. That is whom to approach when you have arthritis. See, when you have a joint pain, we normally tend to go to orthopedics or the physician. We have some painkiller medicines here and there, and we don't get the right diagnosis. So we actually don't know. Until unless I understand, there are specific doctors who treat arthritis. They are basically called as rheumatologists. We will not be able to get the right diagnosis at the right time. So a simple slide for you here where you try to differentiate between a rheumatologist and orthopedics. Basically, a rheumatologist is a physician, they're MD physician, which are further trained in dealing with problems of joint disease. While orthopedics is a surgeon which deals with joints and bone problems. So basically, rheumatology deals with joints and bone, they both deal with joints and pain. But as a rheumatologist, we deal with specifically autoimmune diseases which are related to arthritis. While as far as orthopedics are concerned, they also deal with joint problem, but they are more different than the rheumatologists. They are different than the rheumatologists. They basically include joint trauma, fractures, infections. They are the one who deal with joint replacement. Orthopedics and rheumatologists work in unison. When we have patient with a lot of joint damage, we say refer it to orthopedics where they go through with the joint replacement and improve the quality of life. As far as things are concerned, mode of treatment is concerned, rheumatology only deal with medicines, while orthopedics do deal with medicine, they will all, but they also help you with this surgery, joint replacement and surgeries and everything. So in short, rheumatologists basically deal with autoimmune condition of the joint disease, while orthopedics deal with other joint trauma, fracture, and infection thing. So I think the important question I want to answer is: are the medication used for arthritis harmful? Okay, so when I talk about medication used for treatment of rheumatoid arthritis, just for example, I think I should focus here on three aspects where the people fear the medicines more than the disease itself. So I think the first question patient asked me is whether it will damage my kidney. So if I come, the most importantly, they ask for the painkillers, whether the painkillers which are available in the market are diclofenac, combiflam, hydrochloride. So I think this is a myth. Okay, so if we use our painkiller or the NSAIDs or diclofenac judiciously, then it will be helpful. So I think there are two scenarios where they cause harm. When the patient of kidney disease take painkiller, it is harmful for them. And when you take painkiller for daily, unsupervised, without under any rheumatologist, orthopedist, or any other physician, then it is harmful. The second dilemma that rotates around steroids. So people have prejudice कि steroid लेना खराब है. And yes, true. But we should also understand that the cliche to this steroid only in high doses over the period of long time are harmful for you. But when they are used for short period of time, like 15 days, 20 days in small doses of 5 milligram, 10 milligram. They are really helpful for a joint, but in short period, they shouldn't be taken unsupervised. So the patient come to me, sits in the OPD, sir, bole, sir, dawai heavy mat likhna. So I really don't understand so much of prejudice in the patient mind to the modern medication, because I think the important thing I have to tell here is the medications which we use here for rheumatoid arthritis, all these medications, they don't directly damage your kidney. They are all safe medication, but they have to be monitored. Because what has happened in the society, the right doctors are not using, because the doctor we should not use this medication have been using it quite unrestricted. So the right medication has been used by the doctors incorrectly. So whatever medications we have in rheumatoid arthritis have gone a rigorous research over the period of 20 to 30 years, and they have been marked quite safe. So as far as medicines are concerned, I only have a one important message for my patients कि दवाई से डर के बीमारी को नहीं भूलना चाहिए. ठीक है, medicines which we use are good medicines, but when they are used at wrong time, when they are used in wrong doses, and when they are used the wrong duration, and used by the wrong people, like you self-medicated, medical shop owner advises you, or you go to the wrong doctor and they use are not in proper manner, then they are harmful. If you are being given this medication by the correct doctor, I think that is the key to the safety of this medication. So the key here is qualified doctors and the correct doctor should treat you for the rheumatoid arthritis medication. So I think the prejudice about arthritis medication, modern medication, the word because allopathic medication harm everything and you do not become better. And I think completely wrong. There is some cliche to it, and you should always meet your doctor and clarify everything. So I think I will talk next about exercise, diet, and I will give some tips about management of arthritis. I think exercise and diet are the most important pillars of your management because without exercise, you will not get 100% response to a treatment. I want to first clear the myth around this exercise. People come to me, सर मैं घर का काम तो करता हूँ, what else do I do? घर का काम तो होता है, उतना तो चल पाता हूँ, but I think arthritis needs some specific kind of exercises which are not done in your day-to-day daily routine activities. And just to give you some more idea, the exercise which you do are three kind of exercise. One is stamina exercise, the other is stretching exercise, and the third one is strengthening exercise. The stamina exercise is running, jogging, and skipping. The stamina exercise is not going to replace your stretching or strengthening exercise. So if you're doing running, jogging, and skipping, correct, continue it. The second kind of exercise are stretching exercises, yoga kind of exercises, range of motion exercises are the important exercise when you start to age, when the body loses the elasticity, they just keep you mobile. And the third kind of exercise are the strengthening exercise. And I think these are the most important kind of exercises which I advise to my arthritis patient because maintaining the strength of your muscles around the joint will keep the joint safe for long period of time. So because there is swelling in the joint, the muscles, because they're swelling, don't do the muscles around the joint. And because you're not using a muscle, they become weaker over time. There's disuse atrophy of the muscle. Also, when the joint swelling and everything goes down, you start to use that muscle, it again start to pain. So I think strengthening the muscles around the joint will actually improve the power in the muscles, and down the line, your quality of life will improve. So exercise is the must. It contributes to, if not less than, it contributes to around 25% of treatment. It is one of the most important pillar of arthritis treatment. And maintaining your mobility, it maintains your mobility, it maintains your strength, and it maintains your function. So suppose you have a rheumatoid arthritis of small joints of the hand, you are difficulty in opening up your bottles, you're opening up your tap, you're opening up a difficulty in opening up the bottle. So because there is difficulty, there is arthritis of hand joints, your hands muscle become weak. So your quality of life is affected because of arthritis, because of the weakness of the muscle. And even when the arthritis goes down, if you don't exercise your muscle, you don't gain back your functionality. To gain back your functionality, I think exercise are the must. So diet. So I think diet is one of the most mismanaged part in the arthritis patient. Every patient I see in the OPD, I have to talk about diet part because there is dilemma, there is belief in the Indian society can diet can cure each and all kind of arthritis. Okay, so I think this is lot of extrapolation to this. Yes, there is only one type of arthritis, that is gout, in which we have certain diet modification which partially prevents the attack of joint pain. But if you look at other 149 type of arthritis, there is no any specific dietary modification. Okay, so you don't have to do any specific dietary modification. If someone says you please don't chop dahi, khatta, limbu, meat, I think it's all myth, it's all wrong. You just have to do partial diet modification as far as gout is concerned. As far as all other arthritis is concerned, you have to just maintain your healthy weight, healthy height, because it becomes difficult to manage arthritis in obese patients. So the medicine don't work so well in obese patients. So maintaining a healthy weight will also protect your knee joint, ankle joint specifically down the line when you are dealing with osteoarthritis. So currently, and the current literature, there is no evidence. So I think sticking to the correct diet pattern as per your weight and diet is the thing going forward. Okay. So I have certain tips for arthritis patient. I think arthritis patient, apart from their joint pain and swelling, there are a lot of things have to deal with. So it's like living with arthritis is different than living with other disease because you're living with hypertension, diabetes, your family members understand. Yeah, ये salt नहीं देना, ये नहीं देना. But when it comes to arthritis, you have to deal with multiple things. So one of the important thing I want to point out is managing the social taboo. So there's a lot of health illiteracy around that arthritis part. So I think creating more awareness probably will get away the social taboo. This is one of my efforts to create awareness about arthritis and everything. I think stress management. Every arthritis patient definitely goes with both emotional stress and mental stress. And specifically, if you talk in Mumbai, the two important things that will get you relief from the stress is time management. Suppose you have arthritis patient, you have a lot of demand, your job is challenging. I think managing your time. If you manage your time well, you will be stress free. The second important point is taking good rest. If you are well rested, you will manage your stress. You are able to go through your daily routines in a much better way. So it will also improve your functionality. So yes, you manage your stress, manage. Get enough rest. Chronic pain, you take the doctor. Why do you need some chronic medication for that? Other things is concerned. I think finding the right doctor is the most important thing, and sticking to the treatment. You have to stick to the treatment as the doctor has advised you. That is the most important aspect of arthritis management. I think the important thing I want to focus here is because we meet patients only for 10 minutes, 15 minutes, 20 minutes. But when the patient goes outside in the society, they need something more than doctors, because doctors are not enough to treat the arthritis. So there are your family members are there, other things are there. So I think there are some social support groups which are made by the patients, which help each other uh, get over the difficult time of arthritis and have a happy living. So I have written some of the important links to the social support groups. I have my own blogs where I write about public awareness about the arthritis. And in the end, I want to focus, if you know arthritis, then only manage it. But the most important thing, I am only the coach. I'll always tell you what to do, what not to do. And arthritis patients are all players. Okay. So whatever I tell you, if you follow it rightly, probably will lined up on the better side, you'll be able to manage your arthritis better.